Plague. Plague is a serious bacterial infection that is transmitted primarily by fleas. The organism that causes the plague is an epistis, lives in the small rodents, found most commonly in the rural and the sub-rural areas of Africa, Asia, and the United States. The organism is transmitted to humans who are bitten by fleas that have fed on the infected rodents or by the humans handling the infected animals. They are known as the Black Death during the medieval era. The today plague occurs in the fewer than the 5,000 people a year worldwide. It can be deadly if not treated promptly with the antibiotics. The most common form of the plague results in swollen and the tender lymph nodes called the bulbous in the groin, armpits, or neck. The rarest and the deadliest form of the plague affects the lungs and it can be spread from the person to person. Symptoms. The plague is divided into three main types: bubonic, septicemic, and the pneumonic, depending on which part of your body is involved. Signs and symptoms vary depending on the type of a plague. The bubonic plague is most commonly the variety of a disease. It is named after the swollen lymph nodes that typically develop in the first week after you become infected. Tuberous may be situated in the groin, armpit, or neck, about the size of a chicken egg, tender and firm to touch. Other bubonic plague signs may include sudden onset of fever and chills, headache, fatigue or malaise, muscle aches. Septicemic plague occurs when the plague bacteria multiply in your bloodstream. Signs and symptoms like fever, chill, extreme weakness, abdominal pain, diarrhea and vomiting, bleeding from your mouth, nose or rectum, under your skin, shock, blackening and the death of a tissue in your extremities. Pneumonic plague affects the lungs. It is the least common variety of a plague but the most dangerous because it can be spread from person to person via the cough droplets. Signs and symptoms can begin within the few hours after the infection. This may include the cough with bloody mucus, difficulty in breathing, nausea and vomiting, high fever, headache, weakness and chest pain. Pneumonic plague progresses rapidly and may cause the respiratory failure and shock within the 2 days of infection. The pneumonic plague needs to be treated with the antibiotics within the day after the signs and symptoms first appear of the infection is likely to be fatal. Causes. The plague bacteria is an epistis. It is transmitted to humans through the bites of the fleas that have previously fed on the infected animals such as rat, mice, squirrels, rabbit, dogs, chipmunks, owls. The bacteria can also enter your body if a break in your skin comes into contact with the infected animal's blood. Domestic cats and dogs can become infected with plague from flea bites or from the eating infected rodents. Pneumonic plague, which affects the lung, is spread by inhaling the infected droplets coughed into the air by a sick animal or the person. Risk factors. The risk of developing the plague is very low. The worldwide, only a few thousand people develop the plague each year. However, your plague risk can be increased depending on the area where you live and travel, your job, and your hobbies. Location like plague outbreaks are most common in the rural and the semi-rural areas that have overcrowded, have poor sanitation, and have a high rodent population. The greatest number of the human plague infection occur in Africa, especially in the African island of the Madagascar. Plague has also been transmitted to humans in the parts of Asia and South America. In the United States, the plague is rare, but it has been known to occur in the several western and southwestern states. Primarily, New Mexico, Arizona, California, and Colorado are also affected. Job like veterinarians and other assistants have a higher risk of coming into the contact with the domestic cats and dogs that may have become infected with plague. People who work outdoor in the area where the plague infected animals are common are also at the higher risk of getting plague. Hobbies like camping, hunting, or hiking in the areas where the plague infected animals reside can increase your risk of being bitten by an infected flea. Complications. The complications of plague may include death. Most people who receive the prompt antibiotic treatment survive the bubonic plague. Gangrene, blood clots in the tiny blood vessels of your fingers and toes can disrupt the blood flow and cause the tissue to die. The portions of your fingers and toes that have died may need to be removed. Meningitis. This is a rare plague, may cause the inflammation of the membrane surrounding your brain and the spinal cord. Prevention. No effective vaccine is available, but scientists are working to develop one. The antibiotics can help prevent the infection if you are at the risk or have been exposed to plague. Take the following precaution if you live or spending time in the areas where the plague outbreaks occur. Rodent-proof your home. Remove the potential nesting areas such as piles of brush, rock, firewood, and junk. Keep your pets free of fleas. Ask your veterinarian which the flea control products will work best. Wear gloves. Inspect the repellents. Diagnosis. If your doctor suspects the plague, he or she may look for the Yersinia pestis bacteria in samples taken from your bubbles. If you have the swollen lymph nodes, typical of bubonic plague, your doctor may use a needle to take a fluid sample from them by using the aspiration blade. You will generally have the Yersinia pestis bacteria present in your bloodstream only if you have the septicemia plague. Lungs. To check for the pneumonic plague, your doctor will take the mucus or sputum or the fluid from your airway using a thin, flexible tube inserted through your nose or mouth and down your throat by endoscopy. Treatment. Medications can be given as soon as your doctor suspects that you have a plague. You will need to be admitted to the hospital. You will receive the powerful antibiotics such as the gentamicin, doxycycline, ciprofloxacin, levofloxacin, moxifloxacin, and chloramphenicol. Thank you.